Thank you. Hello, good evening. I'm Iliana Lega. I'm an endocrinologist, which means a hormone doctor, and a big part of my practice is treating menopause. So my job this evening is to talk about hormone therapy and its role in treating menopause. So before I get into all the medical evidence I'm going to give you, and hopefully it's not too much, I want to start by saying hormone therapy is safe for the vast majority of women. But unfortunately, there are a lot of myths around hormone therapy. Hormone therapy is dangerous. I hear this all the time from patients. Hormone therapy always causes cancer. You cannot be on hormone therapy. It's bad. And unfortunately, many doctors perpetuate these myths. And I spend a lot of time debunking them in my clinical practice when I see patients. So let's talk about these myths and where they come from. As a medical community, we're really set back by a study in the early 2000s that many of you may have heard of, the Women's Health Initiative study. This was, and still is actually, the largest study that was ever done to look at the safety of hormone therapy. Unfortunately, it reported that hormone therapy increased the risk of breast cancer, stroke, heart attack, and clots. Very, very scary findings, of course. But so healthcare providers, they stopped prescribing hormone therapy. We stopped learning about it in medical school, even for the most part. And so as a result, we have many generations of doctors that just don't feel comfortable and don't have the knowledge they need to treat menopause. And this has created the significant gaps we see in menopause care. We now know, 24 years later, but we knew this soon after the study too, that there were many flaws to this study. The women included in the study were much older than women we traditionally treat today. And not only that, the hormones that were used in this study are quite synthetic, and we don't use them anymore because we know that they are higher risk. More so, there have been newer studies since that have shown over and over again how safe hormone therapy is. But what are the risks? What are the risks of hormone therapy? We have to talk about breast cancer. Everyone always talks about breast cancer. And while there can be a very small risk of breast cancer with longer duration of hormone therapy, the risk is actually extremely low. And it's similar, if not lower, to the risk that is associated with drinking 1 to 2 alcoholic drinks a day or being sedentary, which are risks that a lot of people accept with no problem. And with newer formulations of hormone therapy that we have, the risks are even lower. In terms of other risks, there's a small risk of blood clots with every hormone therapy, including the birth control pill. But more studies have shown recently that choosing the right type of estrogen and progesterone can really remove this risk almost completely. Finally, with regards to heart disease, initially we thought there was increased risk of heart attacks with hormone therapy. And now we know that in young women, women who are newly menopausal within the first 10 years of menopause, hormone therapy can actually prevent heart attacks, we think, or at least it's neutral and actually may improve heart disease. Despite all this, so many women have been left untreated because medical professionals and women themselves have been misinformed about all these risks. So what are the benefits? Well, there's quite a few, but the best benefit from hormone therapy is treatment of hot flashes and night sweats. These symptoms can be reduced by up to 90%, which means that for most women, they're gone. They disappear. So women go back to feeling normal. They have their life back. And they're incredulous that it's even possible that they can go back to feeling normal. In fact, sometimes when I see patients come back in follow-up, I almost feel like it's a miracle treatment. They are treated so effectively. There are other benefits as well too. Hormone therapy improves bone health, it reduces fractures, it improves sleep, mood, and it improves significantly vaginal and urinary symptoms as well. So currently, today, hormone therapy is recommended as first-line treatment for the hot flashes and night sweats in women who are within the first 10 years of menopause or who are younger than 60 and who don't have contraindications. And this is because in this group, the benefits of hormone therapy far outweigh any risks. Having said that, hormone therapy is not for everyone. So increasingly what I'm seeing in my practice is women who feel they're missing out. They're missing out because now they are beyond 60 years of age and no one will prescribe them hormone therapy, or they're among these very lucky women who are breezing through menopause without significant symptoms. And this isn't helped either by what an increasing number of experts I see, especially in social media, who seem to be suggesting that hormone therapy is a panacea for everything during menopause. Unfortunately, there really is no evidence currently that treating an asymptomatic woman through menopause is going to have the benefits we hope it'll have. And more importantly, in that specific group, we don't know whether the risk-benefit ratio is still in favor of benefit. And for women who are now over 60 or beyond the first 10 years of menopause, we do know there are increased risks in that group. There is an increased risk of stroke, heart attacks, and cancer. And those risks need to be very, very carefully assessed if hormone therapy is to be considered. There are women who have contraindications to hormone therapy, and these include women with a personal history of breast or certain cancer, endometrial cancers. And I really want to highlight that I said a personal history. If you have a family history of breast cancer, or even if you are a mutation carrier for certain types of breast cancer, you do not necessarily have a contraindication to hormone therapy. And for women who do have a contraindication, or for women who choose not to take hormone therapy, there are non-hormonal treatment options as well that can be used to treat some menopausal symptoms. Now, before I end, I want to touch upon a really important myth, I think, and one that really, really bothers me. And this is the idea of compounded bioidentical hormones and the idea that they are somehow safer, better, or more natural than commercially available hormones that are prescribed. I'm going to say, in my opinion, this claim is very false. However, there is a very small kernel of truth here that I do want to unpack. So first of all, what are bioidentical hormones? What do we mean? So bioidentical refers to the chemistry of the hormone. And it means that the chemical structure of the hormone that is in the medicine is the exact duplicate of the hormone your body would have been producing. So in this case, estrogen or progesterone. The truth is that medicines that contain bioidentical hormones do carry less risks than some of the more synthetic hormones. But they are widely available and recommended by medical guidelines. In fact, I preferentially prescribe them daily in my hospital-based clinic. Now, compounded bioidentical hormones, that refers to hormones that are compounded, especially by a pharmacist at a special pharmacy. They're generally much more expensive than commercially available ones. But the bigger problem to me is that they are not necessarily subject to the same level of scrutiny as traditional FDA or Health Canada approved products. And they haven't been tested to prove that the absorption and the levels in the tissue is the same and predictable. There are also potential concerns about the safety of these products with regards to impurities and and lack of sterility. So because of this, medical societies recommend against using bioidentical hormones, compounded bioidentical hormones for the treatment of menopause, except for the rare situation where you need to address a severe allergy or an intolerance to something that's in a commercially available product. So my key message here is that there are multiple formulations of bioidentical hormones that are commercially available, well-tested, Health Canada approved, and recommended by medical guidelines. And if you hear that bioidentical hormones are only available through compounding, you now know this is false and misleading information. So in closing, what I hope you will take from my talk today is that there are extremely safe and effective treatments available to treat menopausal symptoms, which include, but certainly are not limited to, hormone treatments. These treatments can be individualized to address specific symptoms women have, as well as individual risk factors. Knowing this, I hope you're armed with important information that you can share with your family, your friends, and bring with you to your next clinical encounter with your healthcare provider. There's absolutely no need to suffer with menopausal symptoms and no reason to avoid menopausal treatments. Thank you.